Good everyone. For those of you who do not know me, my name is Terri Harris. I'm the publisher of the Denver Urban Spectrum. And I want to welcome you all. And thank you for joining us. We will be doing this on Facebook Live, so we want this to be lively and interactive for everyone. But you know, the purpose of today's event is to provide a better understanding of the vaccines and the pros and cons of the vaccination. We provide insights from these medical experts that are here with us today. One came from Las Vegas, but you'll get more of an introduction there. I'm not going to do that, but Alfonzo will be doing that. But one of the important things is, we sent out a press release, and I like what Lakeisha Hodge said. She said, "You don't know what you don't know," and you have to learn, what you don't know, and an event like this makes it a lot easier. So it's difficult. I don't know. We're just cheering and talking about. Sometimes it's difficult to get people out. The comments, tying this up. Maybe people are still scared of the virus. It's out here. People are scared. So it's important that we still get our voices out and get this message out. So that's why we decided to be on Facebook Live. So you will hear from a couple of people on why they did take the vaccine, and a couple of people why they did not take the vaccine. You will hear from this panel of medical experts. We're going to have a conversation on questions, Q&A. So get all your questions out there. So before I turn this over to Alfonzo Porter, I just want to acknowledge and thank Mabel Sutton for providing the lunch today. Mabel Sutton Realty. You can always find her in the Denver Urban Spectrum, denverurbanspectrum.com. Pick up print copies. And also there will be a vaccination clinic from 2 o'clock after this event. So if you haven't been vaccinated and you're trying to get after you listen to this information, it will be available for you here today. So without further ado, I'm going to introduce Alfonzo Porter. He's our editor of the Denver Urban Spectrum. He's going to take it from here.
Thank you very much, B. Good afternoon, everyone. Thank you for taking your time to come out for this critical conversation on COVID-19 that continues to ravage not only our country but the world. We're going to have a basic introduction of our citizens panel. Once we introduce them, I will then read the bios of these august individuals who are sitting next to me. Then we'll come back and get some commentary from our citizen panel. So we have Ms. Essence Brown.
Oh my gosh.
Terri Hodge. How you got? Jason Mcbride. And Ms. Sandra Williams. Guys, thank you so much for being here. We look forward to a frank discussion with you. So I'd like to begin with our panel. To my left is Dr. Johnny E. Johnson. He's demonstrated a commitment to excellence and quality patient care for more than 30 years of combined experience in clinical practice, teaching, mentoring, practice management in obstetrics and gynecology. He is a Vietnam veteran that was honorably discharged from the U.S. Air Force. He was given the Airman of the Year Award as well as earning a Medal of Honor. Dr. Johnson earned an Associate of Arts degree at Yuba Community College before earning a Bachelor of Science in Zoology at Marshall University. Thereafter, a Master of Science in Developmental Biology at the University of Cincinnati and a Doctor of Medicine at Meharry Medical School. He has his medical internship at the residency at St. Louis University of Medicine, and afterwards earned a Master of Healthcare Science from the University of Texas. Welcome, Dr. Johnson. Next to Dr. Johnson, we have Dr. Terry Richardson. Dr. Richardson was born in Atlanta, Georgia, and grew up in Northeast Denver. She attended Stanford University, where she received a BS in biology. She received her MD degree from Yale University of Medicine and completed a residency in internal medicine at the University of Colorado Health Science Center. After completing her residency, she worked at Eastside Health Center, Denver Health, and after 17 years there, she began practicing at Kaiser Permanente, Colorado. Dr. Richardson has over 34 years of experience as a clinician, health educator, mentor, and volunteer in the health arena. She retired from clinical practice this past June, but remains active in health-related endeavors. Congratulations on your retirement. And finally, ladies and gentlemen, we have Dr. Rowland, and he is a highly trained and professional educator, medical doctor, and infectious disease specialist, who has, you may have seen on MSNBC and CNN and many others. He is a regular contributor for the Black News Channel and has been featured in Denver's Urban Spectrum multiple times. He is a distinguished professor of biology and an expert in limb salvage and reconstructive surgery and diabetics. He earned a Bachelor of Science degree in microbiology and chemistry with a minor in military sciences at Weber State University before going on, earning a Master of Science degree in cellular and molecular biology from the University of Nevada, Reno School of Medicine. From there, Dr. Rowland earned a Doctor of Podiatric Medicine degree from California College of Podiatric Medicine and Surgery, as well as a medical doctorate degree from the University of Health Sciences in Antigua. So as you can see, we have an extremely qualified panel to talk to us in real terms about the things that we're facing with this deadly virus. So please ask pointed questions. Don't spare them. Don't throw softballs, as Dr. Rowland told me. Don't throw softballs at them. Just ask them what you want to know. And so, ladies and gentlemen, this time we're going to go back to our citizen panel and for a brief remark from them. And so I'll go ahead and start with Essence. Please introduce yourself and tell us a little bit more about you.
My name is Essence Brown, and I'm the manager for the Rowland Foundation.
Essence, can you stand up?
Well, my name is Essence Brown. I'm the manager at the Rowland Foundation. I am not vaccinated. I don't really plan on being vaccinated. I do have 4 small young children, 2 of which do qualify between the 12 and up to be vaccinated, and I don't plan on getting vaccinated either. Thank you.
Thank you very much, Essence. We look forward to drilling down a bit more on that. Denny Hodge. Denny?
I'm Denny Hodge. I work with the Stellar Love Foundation through the school thing. And I'm not vaccinated either. Now I live through life.
Okay, thank you, Denny. Jason, please.
Jason Mcbride, secondary violence interruption specialist for Struggle Love Foundation, also founder of Mcbride Impact. I am vaccinated. I did it because I had to, I wanted to see my mom, and she was in an assisted living facility, so I had to do that. She's no longer there though. So I have some trepidation about the vaccine. So I just want to know what's going on. I want everybody to be safe, be healthy, and if it's through the vaccine, then that is, I think, the path. But I think we all just want to know what is the vaccine about, what is in it, and how can it affect us. So, thanks.
Thank you very much, Jason. And finally, Ms. Sandra, please.
Hi, everybody. I am vaccinated. I was hesitant to get vaccinated, but I decided I still work a couple of days a week in an assisted living facility. So I decided that would be the best thing for me to do. I know that we've had viruses for as long as I can remember, from polio to tuberculosis to I can't think of smallpox. Yes. And so I realized that we'll always have viruses. Okay, this one was scary, and the reason I hesitated is because of the misinformation, and there's so much information, overwhelming and all different, and then it made you kind of wonder. I mean, you had to sort it out, and I think that it took me a long time to figure it out, and so I decided to get vaccinated.
Thank you very much. Ladies and gentlemen, at this time, we're going to have brief opening remarks from our panelists here, and we'll start with Dr.
Good afternoon, everyone. It's an honor and a privilege to be here.
I love the opportunity, inclination that I always wanted to deliver babies. Provide healthcare for women, because I thought women at the time had so many healthcare disparities that I can make a difference. And you can't make a difference one at a time. So I came here, and I can honestly say that I delivered over 20,000 kids.
Wow.
So I'm always thankful for this community had a lot of trust in me. That when I came here, there were actually maybe one or two other African American doctors in the community. So you can say I got skin in the game. You know what I mean? I'm vested in this community. So we have formed a medical organization called Mile High Medical Society that we have black doctors that look out for interests and the welfare, but also to act as a resource for the community. So I want you to Google us and get to know us. So if you look at the vaccine and COVID-19, as a healthcare provider, we are being crushed. And guess what? We're being crushed again. And we'll go over that more and more, but I tell you, the strain that this is putting on the healthcare system is unbelievable. Hospitals in Houston may wind up shutting down. They don't have any more ICU beds in Houston, and pediatric ICU beds in Dallas. And Arkansas. So the thing is, this is real. And we're gonna have to come together as a community, people, community, this state, this country, and realize we still living in a pandemic. And this is the fourth wave. And there's gonna be a fifth wave. And in 5 years from now, we're gonna be talking about this again and again. But hopefully, we're gonna come up with some solutions. Because the young lady and the young guy that said they have not been vaccinated, I want to ask you, what's your plan to help protect yourself, your family, in this community?
And we'll get to that.
And we'll get to that, right? So I'm just landing frank so you can think about it. So I'll cut it short because I want to have the other
Take your time. Take your time, guys. Dr. Richardson.
So I want to start out with this, is that the COVID-19 situation first came to my consciousness in March of last year. And it didn't start out well for me. I was at a basketball tournament. I love sports. And we were laughing in the stands saying, why do they keep wiping things down? And what are they doing? And it's like, is anybody worried about COVID? We're like, no, we ain't worried about COVID. We're worried about who's going to win this game. So shortly after I got back, and I usually don't travel a lot, but I had traveled a whole lot. I had gone on 3 different trips. So I came back, and shortly after I got back, they shut everything down. And as a primary care doctor, I deal with a lot of different vaccines. But for this one, I usually tell people, let's wait about a year after a new one comes out. And I initially was thinking the same thing about COVID. But then I started hearing about the deaths. And more importantly, I started talking to my patients on the phone who were very sick with COVID or who have had family members die. I remember one case where 4 family members all were infected because someone came into their house without a mask. They hadn't, the vaccine wasn't out at that time. And one of the family members died, and then the rest of the family were left to deal with that. And they were saying, why wasn't it me? So early on, I said, I'm going to bite the bullet and get my vaccine. Not just for myself, but for the community and for my patients to show I have belief that this will get us to closer to normal. I'm going to go ahead and do it. I had the people giving me my vaccine take a picture. I put it on Facebook. I got it more shares than I've ever gotten. Because people are like, hey, the doctor's got her shot. And I wanted to do that for that purpose, to show I believe in it. I had a certain way of thinking at one point, but I had to change that thinking because we were dying more. And this was a way to keep people from dying. And that was very important to me. And here I am, a representative of the community, and people are seeking my opinion. And I said, I'm a show me person. Let me show them that I've got this vaccine. I got number 1 and I got number 2. And when I got number 2, I had on the t-shirt, trust me, I'm a doctor. But it's more than I'm just a doctor. I'm a community doctor who cares, who's passionate about the Black community. You know, I love all patients, but people that know me, I'm like, let me take care of my people.
Amen.
And with this one, I said, this is how we can take care of ourselves and the community. And I'll stop there because you guys know I can get so passionate, I go on and on. But I'm going to stop there. That's my story, and I'm sticking to it.
Thank you, Dr. Richardson. Thank you very much. This is quite a bit of information. We're going to run out of time trying to drill down on all of this. Lastly, ladies and gentlemen, our esteemed guest, Dr. Rowland.
Good afternoon, everybody. I'm Dr. Rowland. I don't know where to start at. I would like to, I always have a thing in the military. We have a mission and we accomplish it. Special Forces guy. My story started when I was 5 years old when the white teacher told me I should have been in special ed because I was retarded. And I remember when my mom came to school and the teacher said we need to put Sid in special ed because he had a speech impediment. He was slow. And my mom said, no, he was bored. When they were talking 4 plus 4, I was thinking 9 times 9.
Right.
But somehow I ended up getting a microscope when I was 5. Fell in love with that microscope, and that microscope became my world. And I wanted to be an astronaut, a fighter pilot, or a heart surgeon. And, you know, I got some of the goals. But my life is a reflection of our society, the world. And what drives me and gives me my inspiration, my passion, is to save other people's lives and stuff. As I've gone through that journey, I've learned that you have to be a leader is somebody that always gets out of the boat, no matter how difficult it is or how hard it is. When I'm in the jungles of Peru and I'm doing real world missions and we have to hike 16 miles in the jungle, I got leeches and snakes and all that stuff I have to deal with to go vaccinate a village of people, children that don't look like me or does not speak my language. That's what it's all about, being a humanitarian. And so coming back here now as a representative of somebody that's highly trained like I am in infectious diseases and doing real world clinics in Ebola, dengue, chikungunya, malaria, villages wiped out by rabies and putting children in body bags. I have a real life experience, not drinking a Starbucks coffee up in Idaho and don't got a passport. So when I came back to the States a year and a half ago, it was to come back to give you folks, especially black folks, that look like me, eat grits, collard greens, cornbread, and peach cobbler, to be able to relate and have real information and not some talking head. And we're going to talk about vaccine hesitance. We're going to talk about real medicine. We're going to talk about what a vaccine is, et cetera, the science. Because if you understand the science and the medicine, you can't go wrong. There's a reason why I have 6 degrees. Because I got tired of people telling me I wasn't smart enough. Now I got all the degrees. So what can you say? So we're going to learn today, real time. I'm not here to be your friend. I'm not here to be your buddy. No, I'm not. I'm here to give you the information. You take it. You're going to learn. I told you folks what's going to happen last year.
Yep.
And 800,000 you guys are gone.
Yep.
You don't listen to me, I can promise you, some of y'all are not going to see Labor Day. You won't see Thanksgiving. You will not be here for Christmas, and we'll be talking about you guys next New Year's. So you better listen and not be complacent because the storm is getting ready to pick up, and that's a fact.
Thank you, Dr. Rowland. That's real, and we appreciate it. And I want Denny and Essence to know that we hear them. That when they say that they're hesitant and the reasons why they don't want to take the vaccine, and that it's personal to them. And my question then is there, as medical professionals, anything that you can offer, anything at all, to these two people in particular, to say, change your mind?
Well, let's keep it real, guys. I tell people I can give you the Dr. Rowland version, I can give you the Mickey Mouse. What do you want? Most people want the Dr. Rowland version. The vaccine for black folks is a major problem because of our history. Mm-hmm. We can talk about the Tuskegee syphilis experiment. I can talk about the black boys in New York where every time a black boy acted up, they did a lobotomy. Mm-hmm. I can talk about the black females in Alabama who they were cutting out black females' vaginals without anesthesia. Mm-hmm. So don't tell me it's raining when the storm is already here. So there's a reason why we're here, and I tell people, if you're going to take care of Big Mama now, Why don't you take care of Big Mama 3 years ago when she had high blood pressure and diabetes? And all of a sudden, black people are the flavor of the month now. Get back. I've never seen so many black people on television in my life. Injecting this person, injecting that person.
Yes.
Oh my God. So I understand what you're doing. But the bottom line is you have to understand the science and the medicine. And that's what we're going to explain to you. I'm going to explain to you today why the vaccine has a viewpoint, both positive and negative. And you're going to have to make that decision, informed consent. When I operate on a 3-day-old baby who has a congenital defect, I tell the parents this is the possibility that could happen. And y'all need to make sure that you understand that, and that's what we're going to make sure that you have the information, be it positive or negative, because we have a long ways to go. And I think when we get done here, you're going to have a pretty good understanding.
Thank you very much, sir.
You know, we've been out in the community talking to people about the vaccine, and we ask people that don't want to get it, why not? Some of the things we've heard is that people are tired of folks telling them what to do. And so usually I don't try to tell people what to do. I just make sure that you have enough information to make a conscious decision for yourself. We are in America, it's free will, but I like what Dr. Kizamikia says, Corbett says, that getting a vaccination is community service. This is an instance where you're not doing it for yourself, but you're doing it for the community, you're doing it for your young ones, other people in society as well. But it's your choice. If people decide not to get the vaccine, I'm not twisting anyone's arm. I'm just making sure that you're using credible sources, that you have the right information, and that you're the one that's going to have to do it. No one can really force you to do it. So that's what I would add.
And I hear what you're saying, and the time is here. It's like the train left the station a long time ago about this virus. So if you want to be proactive, just stay with me for a minute. I'm putting on my holistic hat. I'm getting out of my, and I'm saying that if you can do something, then what should you do to help protect yourself in the interim while you make your mind up where you get this vaccine or not? Because we're not done yet. So then, how healthy can you become? Are you sleeping, exercising, eating? What about supplements? Vitamin D3. And you can probably allude to that. There's some strong evidence that vitamin D3, sun is helping. We're trying to boost your immune system. Vitamin C, probiotics, omega-3 fatty acids. Don't be sitting there saying, I'm not going to get vaccine and I'm not going to do anything. What you're going to do is want to get the virus. So how can you boost your immune system and things like that is what we want to address with you guys.
And wear your mask properly.
Yeah,
That
right.
means your
Social
nose and
distancing
your
and all,
mouth
yeah.
has to be covered. All the other public health measures, washing your hands.
Let's set the clock back, guys, because we're at ground zero. I'm going to reset the clock back now. Well, should have happened a year and a half ago, what I've been doing for a year and a half. You guys need to understand what you're dealing with. This is the virus. It's a SARS virus. It's an RNA virus. It mutates on a regular basis every 2 weeks, period, end of story. This virus came from a bat. Bats carry over 400 different coronavirus. And out of the 400 coronavirus, 7 of them affects human beings on a regular basis. This virus came from an individual in China who went to a wet market. He ate bat meat. Maybe he didn't cook it very well. But the bat jumped virus into him, and this is where we're at today. This virus is transmitted by 3 ways. 1, respiration. 2, secretions. 3, feces, or what we call waste. That's the reality. How do you protect yourself? This virus is an airborne virus. You got to wear a mask, period. I don't care if you're vaccinated or unvaccinated. I don't go into a biological warfare laboratory or I'm in the jungles doing an epidemic clinic viral, not wearing a mask on a viral disease is airborne. What are you going to wear? You wear what? You wear a mask. Doesn't matter if you're vaccinated or unvaccinated. And then we're going to talk about some of the other stuff because you folks are so confused. It's unbelievable because of the misinformation, disinformation from Fox, CNN, all these people on there. I don't get it. Where were you 2 years ago? Why did you jump into a lane of infectious diseases where you have no training in? Spitting out information. That's why you're confused. So I'm going to make sure today before you leave here, we're going to talk about 2 words in vaccines called vaccine efficacy and vaccine effectiveness. And that's very important. For example, vaccine efficacy means I take 100 people. I'm going to make a vaccine. I inject people. 5 people get a headache. That's a 95% vaccine efficacy. That has nothing to do with the real world. Because when you take that vaccine efficacy and you put it into the real world, and you start injecting Big Mama that has high blood pressure, people that have sickle cell, people that have autism, pregnant female, people that have autoimmune disease, that number is going to drop down from 95 down to probably 20-30%. And that's what they should explain to you guys, that also with the vaccines, there is a role for the vaccine, that even if you guys do get the vaccine, the antibodies only last for 85 days. I told you guys a year ago, you will be getting a booster. There's a reason why you have to get a booster. Why? To supposedly increase your antibody levels to neutralize that virus. So this is the information you guys have to understand to be able to make that best decision for yourself. And then the most important thing, everybody that's going to raise your hand. How many people have had the vaccine? Everybody raise your hand who got the vaccine. Put your hand down. How many of you folks know your antibody levels? No, what was the number?
I don't know. I can give it to you from my Kaiser doctor, though.
That is the most critical thing in a vaccine platform is you have to know what? Your antibodies. Period. Because that tells you, when we're talking about herd immunity, getting to that 90%, antibodies for the protection of the population, you measure antibodies. And if the antibodies are level, that tells man the population is covered through vaccination, through infection, and if it starts waning, what do you got to do? You have to vaccinate, booster, or people will get affected again. So this is a common basic virology vaccine that you got to understand. Miss Sandy,
Yes.
you got vaccine, right?
Yes.
Or you will be getting a booster. Do you know your antibody level?
I don't.
Is it very important to have that?
Yes.
It's very critical, guys. And that is the most important thing worldwide. I'm saying it on MSNBC, I say it everywhere. You have to know your what? Antibodies.
Now, Dr. Rowland, I did want to ask you a question, because you mentioned about the vaccine being efficacious in certain groups, but you said someone with high blood pressure and all that. Were there people in the clinical trials that had chronic diseases or other things, as far as you know?
Dr. Terry Richardson.
Because you said you want people to have the information, so I want to make sure that they understand who were the participants in these clinical trials. Were there people that had chronic diseases, sickle cell anemia, were there any pregnant women? That's stuff that people need to know about, because that's part of the equation.
Thank you for asking that question. This is a very important question. And I've talked about this, and all you guys can Google me all day long. I talk about this. I've read the actual paper that Pfizer submitted for their vaccine. And guess where they did this at? In Germany. Guess what? All of them were white. They were 18 years old to 58. Half of them were females. And they say in the paper, antibodies last 85 days. But better yet, I have a photographic memory. In parentheses, we did not test old people, pediatrics, immunocompromised, minorities. We're going to test them in the field. That's in their paper. You guys are the experiment. This is why it's called experimental use authorization. Don't take my word for it. I got the paper posted on Instagram, Facebook. I talk about it. Read the actual paper. And to your question, you're absolutely correct.
There were African Americans and other people of color in the clinical trials for Moderna and Pfizer.
Germany.
Well, Pfizer has Germany and it has U.S. So I think it's important for people to know that we had more black people in these trials for the mRNA than most other clinical trials that have occurred. The only reason I'm not trying to say, maybe you're the virologist, but I know that it's very important for me to know if people that look like us were in these trials, and they were. And I've seen papers from the National Medical Association that tried to ensure, that's a black medical group, the National Medical Group, that said, we work to get black people in these trials so we can see how it affects people.
In the initial paper, there were none.
Okay,
Now,
but later on, yeah. But we said we're talking real talk, and we're trying to make sure people have the information they need. There were black people in the trials. There were Latino. There were older people. There were people with chronic diseases. And there was a few pregnant people. There weren't a lot of people with sickle cell disease. But there were black people. I want people to understand we did have people that looked like us in the trials. And I don't know the total numbers. I think it was 10% for the mRNA. Go ahead, young man, sorry.
So right here, this is what gets us confused. Right?
We all like,
We got two doctors
Yes.
saying two different things right here on the panel, right in front of our faces, right? He's telling us what we believe.
right.
We experiment on these black people again. That's why we have high blood pressure now. That's why we die earlier now. Because none of these medicines are built for us, just like cocaine. That's why white people they can drink in the morning. They do cocaine before their job. They can live off of it forever. All of this stuff is not made for us. See, I'm looking at it right here. You just confused the F out of me because you're telling me it was no. She's telling me it was. Then you said no, it wasn't. It's the second round. Then she said, yeah, that's correct. The second round.
But let me this backtrack. In the initial study period, this is science. There were none.
Right.
Now they're recruiting. That's what they do. This is the second part of it. Now there are blacks in this, and you guys are the experiment.
Right now.
That's
Live.
the fact. And they don't have because folks, you have to understand, it takes 3 to 10 years to make a vaccine.
Right.
Period. End of story. You cannot take a vaccine within 8 months and do all the different subtypes. It's impossible. You can't take 1,000 black people that have blood pressure, 1,000 Asian, this. Then you come up with the famous word, vaccine effectiveness. That is the most critical word I'm saying is vaccine what? Effectiveness. That is real time in the field.
Okay, so let's just kind of hold the
You know, we
questions
can
from the
cover on that,
panel.
and we're not
Right.
trying to confuse people, but I think, you know, if you go out there and look, you'll see. But, you know, so
Yeah.
hopefully we didn't confuse you, and there were
Yeah, I
black
got
people
confused.
involved.
No,
And he agrees that there were black people involved in the study.
And we can certainly understand. I mean, so we're gonna drill down some more, and we're gonna give you guys all the ammunition you need
Make
to
the best
fire
decision.
this way, because I'm listening to it too, and I'm thinking, well, okay, but you know, Ronald Reagan once said the 9 most terrifying words in the human language are, "I'm from the government and I'm here to help." In the interest of full disclosure, my mother passed of this in the very first wave, last March, going into April, the first week of April. So this got real fast for me, because obviously we were hearing about it, and it was those folks over there, and you know how you feel like it's those folks over there. It's never me.
It's somebody else's problem.
Next thing, you know, they're wheeling her off, and I never saw her again. And so I became afraid not to take the virus because I saw in real time, in a real way, that absolutely ripped my heart out. Just that quick. 7 days. So let's kind of get back to this point. There's been much controversy about how the antibodies can protect the health of those who take this vaccine. Now, Dr. Rowland, when we interviewed you at the very beginning, you said things like, well, it only lasts so long. And then everybody blew back at you. Well, how does he know that? We're trying to fact check it. We can't find any information. Here we are now saying, oh, gee, by the way, we need a booster. Right? So we get the booster. What happens after the booster? Do we need a booster for the booster?
Right.
Hey, folks, we're keeping it real, right?
Right.
We got the afros out, gloves out. We get in the mud. We gonna make it happen. Let's get right down to it, guys. The reality is that every time there's a new variant mutation, you have to come up with a new vaccine. Now, the question would be, if the vaccine is so great, why did 151 people die in Chicago last week that were vaccinated? Don't come out with this new political word talking about breakthrough infection. It tells you that that vaccine has a limitation. And the reality is that every time there is a new mutation, guess what you have to make? A new vaccine. That's just the reality. And then if you really want to get technical down to it, you need to measure in people's antibodies. If you're going to do a booster shot, am I right or wrong? A full vaccine program, holistic, is not just you get a shot, you give Big Mama a shot day one, Big Mama comes back in 30 days, you give her a shot and that's it. Well, doesn't Big Mama need to know her antibodies? Because the antibodies is what we talk about, the neutralizing antibodies that protect you against viral infection. You're supposed to bring down the viral load. That is the reality. Folks, in the real world, in a coronavirus infection, there is no affinity maturation or what we call conferred immunity, which means you don't have long-term antibodies. They're here for a minute and they go. That's why we get affected by the common cold every year. And so reality, like I said a year ago, and you're right, I told you guys what was going to happen. I got blowback. Now, what's he talking about? I'm a virologist. I know the science. I don't have to argue with anybody. And guess what you guys are going to be doing? You will be getting a booster off of this alpha strain, not the delta strain, or the gamma, or the lambda, or the eta, or the iota. There's probably 20 more coming down the pipeline that'll be here in the next couple months.
Okay.
Yeah.
Okay, so here's a real question for you. We're now seeing those instances of people who are fully vaccinated dying. Now, please talk to me about how I can get the vaccine that we're telling everybody that you better get. And so that now I got that vaccine, and so now I've got my superpowers because I got the vaccine, and I don't need this anymore. There's no mask mandate. And now you get it and you die. So how is it possible that we're fully vaccinated and die?
Well, I'm gonna go on special forces mode. I'm gonna let them two answer first, and I'm gonna clean up.
We're gonna let you go.
No, you go first.
That's
That's what they need. They need to kind of hear this.
So let's be for real from there.
We keep saying
It's like this. No, this is the essence of it. If you get up in the morning and you realize you're not a person of color, call me. So I can remind you. Because you're going to be an experiment, and we look at where we are today. You get a booster, no, you get the vaccine, Pfizer, Moderna. Then you're getting a booster, but you're not getting a booster right now unless your immune system is compromised. I think, and you're really not getting the booster. What you're doing is just getting a third shot.
Thank you, Sonia. Thank you.
But they're working on a booster that's specific to the Delta, and it's a new strain, not called Lambda, out of Peru, and it's in Louisiana now.
Vegas.
So we're just constantly working on it. So it's up to you. How can I best protect and keep myself healthy from this? Pretend like the vaccine is not here. What would you do? You got to do something, right? So you got to be proactive. But I'm telling you, like you said, you will be getting a booster, just like getting a flu shot every single year. But I don't know. Maybe the next 50 years that you'll be getting one.
So, and what I would say is that the majority of people right now that are dying from COVID have not been vaccinated. And am I correct about that? The majority of people that are dying have not had the vaccine. The majority of people that are getting severe COVID have not had the vaccine. That's a fact as I've heard them and know them.
Let me ask some of this, guys, because we're here to learn. And I want everybody to have, listen to me very carefully, guys. It's not a game. And when we put you in a body bag, it's over. Done. You're a footnote in life. You have to understand that right now, in our society, there are over 4,000 different coronavirus. You guys just know about the alpha, the beta, the gamma, the lambda, the kappa, the eta, iota. And here's the deal. You can be infected with 3 or 4 different strains at the same time. We got people in Belgium dying. They got the beta strain, the delta strain, and the lambda strain in the same body. And that vaccine ain't going to work against that. Period. End of story. And definitely not against the African strain. Because the African strain has a mutation. It's so beautiful. I love viruses. It escapes your immune system. They figured it out. When I teach my class in virology and pathogen virology in Germany and Peru, I always ask my students the first question. Do viruses have a conscience? Do they think? Do bacteria have a conscience? How do they know to mutate? How do they understand environmental stress, survival of the fittest and stuff? And so the question is that Not that people gotten vaccinated or unvaccinated. Yeah, there's probably a strong possibility that people that have been vaccinated, they might have some antibodies. And that's preventing them from getting the alpha strain. Because that is what the Pfizer vaccine was made out of, is the D614G. That's what it got from China. They did not get a patient from India that has a triple mutation and make a vaccine. If they did, they would already had it. 3 days, right? mRNA technology takes them 3 days. Why haven't they done it? Very difficult. Coronavirus is changing. And I bet nobody in this room knows that there's another mutation out there, another variant. You want me to tell you what's it called? You don't even know about it. It's called the Vietnam and Indian mutation put together. Don't tell me that they got a vaccine they already made for something that just came out. It's impossible.
So Denny, in essence, I kind of get it. You know, it's starting to sound like a Greek letter fraternity. Right. So we're really. I'm kind of starting to feel you guys a bit more.
Yeah, I understand.
So to this, what you've heard, what did you say? What would you say back to these guys?
So I would say, I mean, just you're talking about the initial trials, how like we are the trial, but I just don't understand why does the minority have to be the trial, but they go to the lab and they'll properly, test it on people who are Caucasian. It's like, why do we always have to eat the guinea pigs? And I have children, so I'm not gonna allow my 13 and 15-year-olds to be anything.
And I'm not gonna let my grandchildren be anybody's guinea pig. Period. And this is what the white guys in France were doing. They said, the guy said it a year ago. We talked about that. Guy told me we're gonna go do this vaccine in Africa. Practice on the black folks in Africa, then we're gonna figure it out. Why are they in France or Beverly Hills injecting white kids?
Exactly.
That is the problem that we have. That's part of that vaccine hesitant. And people don't want to talk about it. Everybody want to, put their head in the sand, butt in the air, bourgeois. But the reality, guys, just keep it real and stuff, okay? And this is the reality we have to deal with. We always have been the practicing on us. You're an OBGYN doctor. My sister's an OBGYN doctor, Chief Baylor. What does that make you think when you talk about this white guy who's supposed to be such a Dr. Sims, the father of your profession, cutting out black women's vaginal with no
So to
anesthesia?
answer your question, we have to answer one basic fundamental question, and that is healthcare disparities
Yes,
and
yes,
racism,
yes.
social economical status, poverty, education. All that has to be dealt with. And I think that I've seen racism in medicine, where they're making a decision on if they're going to rationalize, ration healthcare. Guess who's going to be at the bottom of the list?
Black folks.
Black folks. It's just like I told you. Look in the mirror.
Right.
Call Mile High if you have any questions. We can serve as a resource. You should hopefully be depending on us more so than us.
Yes.
So we're part of this community.
That's
So
true.
we've been a part of this community 30, 40 years.
About a few years.
Few years. A minute. So you have a very good question, and I don't think there's any simple answer to it.
Yeah,
I wanted to add to that, we talk about are we being the guinea pigs. I'm gonna tell you, when the vaccine was released, who do you think was at the front of the line? Who was coming to the black churches to get the vaccine when we were trying to get our people vaccinated? So we really weren't guinea pigs, they were the guinea pigs. Because even in the trials, they're the first ones, as he said, that came to the clinical trials. They're the first ones getting these vaccines, honestly. So.
Well, they know it's safe for them.
Well, let me add something to it, because I talk about this, because we all talk about vaccine hesitance. I'm so sick of hearing Fauci and these guys talk about that over and over and over. They're not talking to you guys. You understand, right? They can't relate to you. You're right.
No,
See, I'm the black guy in the school in the hot zone with black children on my lap. They want to be a virologist like Dr. Rowland. But here's the deal, guys. The reality is that this is why we're where we're at today, because of the misinformation. We have to have people that look like us and be like us. Part of the vaccine hesitance, and I'm in Arkansas. I'm on Arkansas's COVID healthcare task force now. I was there 3 weeks ago in the country, talking. I got the key to the city. They gave it to me. That means I can just get speeding tickets, no problem.
He's great, ain't he?
I wish I
Give him a
had.
round of applause. Give him a round of applause. He cuts us off, he calls us you people. Hey man, I thought we was all together, but I like it.
But here's the deal.
What's not to leave?
I'm in Camden, Arkansas. Mayor Julian Lott. So I'm talking to him through the whole city doing a town hall. I'm talking real town hall. You know, not some superficial. And I say, he says, Doc, this is the problem we had here in Camden. He asked the Governor Hutchinson of Arkansas for 100 vaccines for black folks. They sent it to Walmart. Guess what happened? Not one black person got that vaccine. There were 101. All the white people got it. So he called back up to Hutchinson again, the governor. Y'all see him on television. Y'all see him on television. He's always on. He didn't want to say no mask mandates. And people are dying like flies in Arkansas now. Then he calls back up there and says, hey, I need another 100 vaccines. Sends it to a white pharmacist in Camden. Guess what happened? Black person, 101. All the vaccines gone. You know what they were doing? They were calling their friends. The white folks were calling their people and telling them the vaccine's going to be here, and none of the black people got the shot. So sometimes it's not just straight up, we just hesitant. Sometimes we don't have access.
Right.
Period. This is real time. This ain't no Mickey Mouse stuff. This is reality, what's happening really on the ground that you folks need to kind of understand the reality. I'm sorry, I hate to bust your bubble. I'm not here to be your friend. I'm here to tell you the facts.
He's on the plane.
Well, okay, so let's kind of switch a little bit. You know, we're right on the cusp of the new school year. And I was hearing Essence talking about our 4 children. We've got 55 million public school students about to converge on our schools, 5 million public school teachers. Are they safe? Are they safe? Are they safe? Is she safe to send her kids into the school system? Mask or no mask? Are these tens of millions of people going to be safe? Or are we about to have an explosion of the Delta variant?
Well, they're not gonna be safe. I think that 12 and under is really concerning. Even as a doctor and a parent, I'm really nervous. 12 and up, they can get the vaccine, right? 12
Yeah, that's what
Yeah, 12 and
Yeah.
Pfizer.
Yeah, but I think that is it too quick, too soon, is it experimental? They're talking about doing something between 5 and 5 years of age and 12. I'm not like that. Put a mask on them, teach them social distancing, do that, protect them. And the way we can protect them is we as a community can get vaccinated ourselves in an effort to protect them. And maybe the school teachers. And I think it's gonna come to be mandated. You can't get any place without a vaccine passport now. It's coming.
I would add that, you know, I've opened up schools in North Carolina. You can Google this in the newspaper, Thomasville. I just left Jacksonville 2 days ago, university there. Opened up the biggest church in Jackson, Mississippi, 20,000 people. Little Rock, Arkansas, etc. You can't do it. But it comes down to one thing, that's understanding the transmission of viruses. Understanding how they're transmitted. I call it Dr. Rowland's ABCs. There's 7 F's and 1 R. The R is respiratory. You better wear a mask. The disease is transmitted through air and secretions. You have face, you have feet, species, you have flies, you have fingers, food, formite, and you have foot. If you understand it, you can do that. The ball game here is that we have to get people back in school. That's my responsibility, to get people back in school safely as an infectious disease biological warfare guy. I want kids to go to school because in Jackson, Mississippi, in Lexington, Mississippi, there are 3,000 black kids that are starving because they get their school lunch and their breakfast from the school. And some kids are being sexually molested at home and in violence environments. So the school is a utopia, escape for children. So my responsibility at my level is to make sure we get kids back into that environment. How do we do that? Well, we gotta make sure the kids understand they're not wearing a bacterial mask, they're wearing an antiviral mask. That's what you do. You gotta teach kids how to really wash their hands, really understand antiseptic viral soap. You have to make sure that the bathrooms in public places are clean, i.e. all you folks in this room, I promise you, every day y'all touching touchscreens in the general population. Kiosk machines at the airport, Denver airport. Put your ATM number in a bank machine, Bank of America. All these public places are contaminated with feces. Fact. You touch it, you got to possibly getting sick. You need to become what we call situational awareness, understanding microbiology. Protect your hands. If you do that, we can get society back opening, but everybody has to become little microbiologists. And you have to see the world like that. For example, you guys go to Walmart, Kroger's, I don't know what y'all got here. What y'all got here? Jitney Jungle or something? Safeway. Yeah, y'all go to produce. And y'all want to get your avocado. And the person there don't want to wear a mask. They're coughing, hacking, picking the nose, scratching the butts, touching the peaches, putting them back in there, touching the strawberry, want to taste the grapes. Am I right or wrong?
Yeah. Not scratching the butt.
but we're talking infectious disease, right? We're talking microbiology. Am I right or wrong? And you take that stuff to your house. Am I right or wrong? You better be desanitizing that produce because it's on the outside. We've already done the test. We know. You know, you go to the Denver airport and y'all go in that bathroom, y'all take a dump and you flush that toilet. That feces is everywhere. Aerolized, fecal viral transmission. It's on the bottom of your shoes. How many of you folks are walking in the house with your shoes on? In schools, what we're doing now, we're putting mats in front of the schools. So little guys come in there and they step on this mat that has chemicals in there to disinfect your shoes. You do that, you can get back into kids going back to school.
We'll come right back to you. Okay.
Go for it.
Almost asked.
I'm gonna make a comment, but I see somebody raise their hand.
Are we ever going to get to a point, and I'll come back to the young lady here. Are we ever going to get to a point to where we're no longer dealing with this, or is it something that's with us for the rest of our lives?
Are you asking me or are you asking me?
I'm for the rest of our lives. I think this is going to be adaptive lifestyle behavior.
I've said it, I'm going to continue to say it again. Listen to me very carefully. We're going to be dealing with this for the next 100 years. You will be wearing a mask. You will be getting boosters. Because this virus is figured out. Folks, this is not the first time there's been a coronavirus infection. It happened 20,000 years ago. This is science. This is facts. The virus has just figured it out. It's become more effective in affecting people through your eyeballs, your lungs, your kidneys. I can go on and on. And a great virus does not want to kill you. This virus doesn't want to kill you guys. It wants to keep you sick to make new babies. I call it the HIV virus, but it really is. And that is where we're going. So in our reality, we got new mutations. And the reason why we have these mutations, oh my God, this is so great. Think about this. People are going to go get a vaccine. I was in Vegas 2 weeks ago, 1 o'clock in the morning. Airport packed. Nobody wearing masks, people picking their nose. Just solid people. Good time. They're infected with the Lambda strain, the Delta strain. They go home and say, I'm going to go get a vaccine. What do you think that virus is going to do when that virus sees that vaccine? Been in that body for 2 weeks. This is why we have the problem we have. The virus is going to survive. That's why you have to have 100% effective kill rate. Because if you leave 1% of a virus population alive, or bacteria, guess what they're going to do? You get resistance. That's basic virology. And so we're pushing people to get the vaccine, but what happens if somebody's already infected for 2-3 weeks, they get the vaccine, and it's not a very good vaccine, they make antibodies. Or no antibodies. Go for it.
Thank you very much, guys. It's 1 o'clock at this time, and we want to kind of throw it out to everybody for your commentary, your feedback, whether you're convinced or not. What is it that we can do or they can do to convince you and tell you how to protect yourselves? And I think that's the bottom line. How can we protect ourselves? Whether it's a mask or a vaccine or anything else, we just want people living. Yes, ma'am.
So that was my question, because I'm a caseworker in the community. And so I'm starting to see families that are breaking up, that are having conflicts over this, because the husband will get the vaccine and the wife won't. The children are getting, so now it's becoming like a mental health issue. Now it's becoming a family issue, because families are breaking up. I have homeless families where the mother and the children are living in the car because they don't want to get vaccine, and then the father is vaccinated in the house. So now I'm looking at it as a caseworker. Now we're going to have a whole bunch of added issues where we're dealing with the virus, but now we have a whole bunch of added issues. So as a community member, I'm saying, okay, like now we have the doctors on board. Now we have to get mental health involved too, because there's demographics. If you're, like you're saying, husband goes out to work, he comes home, the vaccine might not have worked. Now he might be infecting his family. So no, those are the things that I'm seeing as a caseworker in the community, is the breakdown of the Black family. And yeah, it is historical. Yeah, it is. And you take the Black man out the family, yeah, it starts to break down. It starts to, so now that's the stuff that I'm seeing. That's the stuff that I'm worried about as a community member, as a family member. Like, are we gonna come together and we know the virus is here. We know that sometimes one person's not gonna get vaccinated. So are we gonna have little hub stations or whatever to talk about it to family? Okay, if you're a husband and a wife and you're not vaccinated, how, like Dr. Johnny said, how are you guys going to prevent that? What are you guys going to do in your household to not prevent that? How are you going to do that in the community so that, yeah, we know this is happening, and as a Black community, it's going to keep happening. So now we need to come together and put things together, because now it's going to be a downward spiral. Now we're going to have mental health stuff going on. Now we're going to have families breaking up. Now we're going to have single mothers trying to figure out how to do what. Now we're going to have this. We're going to have this. So now these are things that we have to discuss, because the virus is not going to go away.
So typically, those are the kind of questions that come back to folks who are in your profession.
Mm-hmm.
So now we're going to be looking at you for those answers.
Mm-hmm.
I was a public school teacher, and everything has to be solved at the public school. So if it's teen pregnancy, what are the schools doing about it? If it's cyberbullying, what are the schools doing about it? You know, if it's drug addiction among kids, what are the schools doing about it? And so we're supposed to have all these answers, whether it's realistic or not. Those questions are coming back to you guys who are dealing with the whole social milieu of our community, right? So now we're looking at you to say, what do we do to save our families and keep them together?
And let me add to what you're saying too, because I talked about this in my book that I wrote 1.5 years ago on how to navigate through the new pandemic. And the psychosocial part is a very important part. We're all affected. I got PTS, Doc got PTS, we know somebody's infected. We have some type of emotional thing that's dealing with. This is part of what viruses do. Causes economic collapse, political. Wear a mask, don't wear a mask, put your head in the microwave, shoot yourself with some bleach. I can go on and on and on. But the reality is that this is our new norm. And I will say this on the public record right now, because I haven't said this. I've always kind of, I give people the science and medicine. The only way we're going to have 100% of the people vaccinated is that you're going to have 100% of people tested every week, and everybody's going to have 100% of people have antibody tests. That's the only way I will support a true vaccine program. Because you got to know, if you're going to school, your kids got to be tested every week. Period. End of story. People going to work. You got to be tested, just like we do in the NBA. They're going to have to pay for people to get tested every week to see if people are positive, negative, and then they need to make sure that people who are getting this vaccine, it's going to be antibodies too. Two-way, that's it. That's how it's got to be.
And to your point, the governor has put in place testing for schools and masks. That's going to be provided. The schools just have to say they want to participate in that. Because I think it's very important for our kids to get back to school. We've been behind, and the longer they're doing homeschooling, they're just going to get further and further and further behind. It's a little scary, but I have teachers in my family, and they say when the kids came and they practiced hand washing, wore their masks, they were able to keep the kids in school long enough to get the knowledge that they're trying to get.
Well, how do we know this is not purposely done for us to educate our own children, for us to raise our own children, for us to build our own neighborhoods and community doctors again? You know, that's the kind of way I look at it. It's like, this is a God's plan. It's like to get rid of it. You know, unfortunately, some people are going to be sacrificed through this journey of getting rid of evilness. You know, I don't know. I'm just You know, because you got a generation of youth that's aged 12 through 30. Their virus is gun violence.
Right,
Their virus is family structure.
right.
Their virus is drugs. So why are we hitting that hard as we hitting this?
That's
Yes.
that goes back to that one word again, and that's that systemic racism. This is people
Yeah,
pick
but
and choose.
we can't use that no more. Us rich
No.
guys like you got keys to the city.
Yeah, but
You said you wasn't here to be a friend. What you-
I hear what you're saying there, because when you look at Colorado, the way that where's our neighborhoods?
Right.
Everything's been broken up, so, I mean, I like the angle that you're taking. Is this our opportunity to get together and take ourselves back? They have intentionally created no neighbor, where are the black people? Because everything's gentrified. We used to have 5 Points, Northeast Denver. You can't find a neighborhood. We were talking earlier, where's the soul food restaurant? Now, some of this, we may be able to take control, but you got to be alive to take control of it.
So let's go to B and then.
I just have one quick question. How do you test your antibodies?
how do you test it?
Yeah, how do you
You go
find out?
get them measured. Lab questions. One of the laboratories. You say, hey, I want my antibody levels. And they measure them. They can tell you what the numbers are.
Is that something you can do with your primary care?
You can do with your primary care. If they're not telling you get it, folks, just put it this way. From here on out, this is the world. Dr. Rowland, you get the vaccine. I want to know what your antibody levels. Send me the report. I'm very curious.
What should it be?
Yeah.
The numbers, depending on what the vaccine is. If it's COVAX, 32,000. If it's Pfizer, 250, 500. I have the chart. I don't know the exact numbers right now, but it's in that
Is
range.
there somewhere we can
Yeah,
access
you can
online?
you can
For
look at the
example?
antibody
Yeah.
level. What's the rate?
Yeah, and the thing is, that's not a standard that people are doing. I'm gonna tell you, in clinical practice, they're not doing that. You can request it, like you say, you've had it. There are people that are getting it, but it's not a standard practice. I'm not saying it can't be done, but it's not standard.
I agree with you, Dr. Richardson, but this is reality. We're talking
Well,
about
I'm just saying, I'm
the
just.
reality is that we're dealing with a vaccine that people are being pushed to take or not take. You make sure it's standard antibodies. Let me give you an example. Because I was doing a show last week, very rich person out of Chicago, went and got the vaccine. They paid for the antibody test the first day. Guess what their antibody level was? 0. Came back 3 weeks later, antibody test second booster. Guess what their antibody level was? 0. Came back in 3 months, 0. 6 months, 0. So what does that tell you? Are they making antibodies? Are they giving people placebos? You got to know what you're getting. You're not going to just inject me and say, man, I'm going to hope that it works. So this goes back to the basic ground game. This is not a controversial. What's the big deal? Get an antibody test.
Well, I got so many questions.
Yeah.
But listen, first of all, you say, it's not the question, but I got to respond to what you said. You said, go get the antibiotic test, the antibiotic test.
Antibodies.
Right. We disproportionately don't have health care. So it's not about just going to get a test, because I understand. I don't know where you're going. I know where I'm going. 'Cause I ain't here to be your friend. And what I also know is that we set up, and we set up and we made a couple of comments dealing with the systemic racism and everything that goes with it. My thing is, I want to get the vaccine when it is proven, not even FDA approved, because I feel like what I have seen is too many people in bed with each other that have the ability to move us from one place to the other. The other thing that Dr. Johnson just said is it's going to get to the point where it's going to be mandated on a passport. Well, I remember historically that we had to have paper just to go from one place to another, being black folks in America. So when you start to create an environment that you mandate that I get something to put in my body because you say it's going to impact you, which I've never known a vaccine that impacts other people other than the person it vaccines for. So you guys are giving us a lot of really great information, but for me, we're sitting up here talking about a vaccine that we have spent billions, if not zillions of dollars for, but we can't give a black community supplemental health care. We can't give a black community in Chicago where babies are being gunned down like nobody's business, go into that community and make that community safe. We can't give black people the basics of the foods that they need to eat so that we can build some natural immunities. But we can tell you to go put some foreign substance in your body and do it over and over and over again. But we don't sit up and say, but I'm going to tell you what you can do. First of all, get them McDonald's, them 7-Elevens, them liquor stores, and them churches that ain't doing nothing for you out of your communities. And put health food stores in there and make it feasible for people to start eating the kinds of foods that at least help us to start fighting some of the basics. Because I'm not getting a zillion shots. I'm not keeping getting your shots. What I will do, though, is I will say, how do I go in this community and let this little black boy, who they have decided was a thug, become the doctor, the lawyer, the politician that he was born to be? Because that's the vaccine I want to spend time in. Because all this other stuff you guys are telling us is overwhelming me. Because it's racism at its best.
Ma'am, let me explain something to you. The reality is that having an effective vaccine, what they should have did, because Pfizer and CEOs, they all cashing on their stocks. You're going to do a vaccine, they're making money. Everybody should be getting tested, period. They should pay for it. But they're not going to do that because it costs money. That's the reality. And that's for poor people, rich people, it doesn't matter. People need to have a test, especially antibody test on the vaccine. I agree with you 100% on that.
But let me ask you a question. If this vaccine is so dangerous for the world, and I'm not using the right terminology, this is just my understanding, why didn't you release the patent so this thing could be made for little of nothing, so the entire world could get it at the same time? Why are we fighting third and second and first world countries with getting this vaccine if it's so important that the whole world get it? Why aren't we letting the Africas and the Asias and the Indias make sure they have this? That's the thing that makes me wonder. And then don't tell me you're going to put me in a lottery for $1 million to take a shot. Don't tell me you're going to give me a gift certificate to get a shot. Don't tell me that you're going to sit up here and try to convince me to get a shot if the shot is supposed to save my life. There is just so many. It doesn't gel. Like what you're saying gels because I trust what you're saying. What Dr. Johnson says really gels because he's my doctor. So I trust what he says. I'm just keeping it real.
But you know what? Let me keep it real with you.
Okay.
Let me get right down to it. That is why they call me Dr. Chocolate. Everybody likes Dr. Chocolate. Sweet. But the reality is that we have to.
I don't know, maybe time we go back.
But the reality is that we have to keep this basic science of medicine. What's happening is that you got people's opinions involved in it. You got people who have a different viewpoint. The bottom line is you stick with the science and medicine, you're going to get good answers. That's why I said when I started this, we have to set the clock back. Most people don't know there's a difference between a DNA and an RNA virus. People don't realize that there's a humoral adaptive immune system. It takes 14 to 21 days to make antibodies. People don't understand that. But if you break it down and you explain that, it gives people more information in the system. And you're right. They got a lot of people out there talking. They can't back it up.
Yeah. Yes, ma'am.
I was just going to ask, we also have I know a lot of people who are into the Bible. Okay, we haven't talked about that. That are saying that they got the whole world to take this shot, and they're calling it part of the end time situation with the 666. I know a lot of people don't know what that is, but there's a lot of people.
June 6th of the 6th hour, the 6th day when the devil was born.
Okay, there's a lot of people that will not take this because they think it is a prelude or something to taking the mark of the beast. Do you understand? I mean, I know I'm kind of talking.
It's real.
Yeah.
It's real.
And so there's a lot of people that, like, I have a sister who is a retired RN. Was an RN for 50 years. She said they'll carry her out because she believes it is part of the 666 and the mark of the beast, and she's not taking it, no matter what. Okay.
And see, this is why we have all this. This is the problem that we've had We got people got involved into an area they should not be involved in. I can't change the oil on a car. I can't change a tire. But I do know infectious diseases. Period. End of story. I mean, I did 2 years of fellowship in the jungles. Real stuff. That's the problem that we have, is disinformation. If people would have sat down and they had a town hall and explained to everybody, this is a virus, transmitted this way, epidemiology, treatment, etc., I think we would have a lot. So, 70% of Trump guys, they're not going to get the vaccine, period. So they might need to mandate the Trump people who get the vaccine. So,
I want to talk about the politicization of this whole issue. I'm a journalist by profession, and a lot of that blowback comes to us for the information that's disseminated to the public. But I want you to know that the stuff that we hear, the CNN, the MSNBCs, the Foxes, that's not news, that's news analysis. That's somebody taking news items and telling you what you ought to think about what's in the news. The news is the basic who, what, when, where, why. And so it is fact-based. So there are several ways to discern. Let's say, for example, we go with legacy news sources. And those are sources that have their name and reputation is built upon getting it right. So, for example, I was with the Washington Post, whose competitor is the New York Times. Now, if the New York Times found out that the Washington Post got a fact wrong, they'd be all over us, right? And so those legacy sources are the ones that you should pay attention to. The guy on Fox News, who's not a doctor, who doesn't even have a college degree, who's telling you what you ought to do and think, those are not the people. But those are the channels that we tend to go to first. We'll go to the CNN and the MSNBC and the Foxes, and we'll listen to this talk. And that talk is not fact-based. That's why there's so much confusion. It is not the field of journalism's fault. We cannot control the entirety of free speech. But what we can do is tell you to go to legacy news sources. Your local broadcast is a legacy source. The ABC Evening News, the 30 minutes, that's all you take, 30 minutes. We don't take 3 hours to tell you what you ought to think. They give you the facts and move on to the next story, right? So stick with your legacy sources for your information and your news. So, but here's my question, and I'll get to you later. But, we know that this has been politicized. And I don't think there's ever been a virus or anything where the President of the United States has led the charge to make it political and pit the country against one another. Now, since the horse is out of the barn, what do we do?
That was going to be a question of mine. If Obama was in,
oh Lord,
if he was in office, right? I'm just saying, if he was in office, he said, "Hey, y'all, everybody go get a shot." Will we be getting a shot? Or is it because what leadership was in office when that happened?
Well, I don't think Obama would have.
You already got a shot. Why isn't everyone else getting a shot then? So,
well,
if he would have been the president, it makes no difference.
His influence would have done.
Well, I think,
Yeah, but he still has influence in the black community. He had a shot.
He wasn't
and we have people that are still not getting shots.
Yeah, he wasn't childish, openly racist, and all the other things that we saw with Trump. Trump clearly had an agenda, which was kind of based on race. Obama was mature, well thought. And he was an adult.
Right.
And so if Obama said something to us, then we know that we could more than likely trust and believe it because we had the faith that he would not lead us astray. With Donald Trump, we expected to be led astray.
What about Biden?
I don't distrust him.
Well, the reality, guys, the reality where we're at today is because of the politics. Yeah. CDC killed a lot of folks in the beginning. FDA, politics. CDC put out a kit to test people and they were wrong. That was 6 more weeks. I can talk about R-naught numbers. One person got the coronavirus can affect 10 people. You do 6 weeks, you can imagine we've got a super spreader. So it was already politics back in January of last year, CDC, FDA, and they've been all over the place. wear a mask, don't wear a mask, don't test people for antibodies for vaccination. What are you talking about? Who is running these organizations? This is where we're at today because of the politics. And this is why the train's left. And you guys' responsibility is to get the best information to protect yourself, your loved ones, your family. Because I promise you guys, you ain't seen nothing yet. You guys had a preview of what happened last year. Part 2's coming up. September, October, November, December. And you guys want to make sure y'all get to the other side. Period.
But why don't you spend more time on I guess what I need to hear more about natural immunity. I need to hear about people who have had it and if they're antibiotic.
Antibodies.
I just need to hear more about what we can do from a nutritional standpoint to be until we make a certain decision so that we can at least build our own natural immunity.
Well, the natural immunity is going to come by, like Dr. J said, it's going to be your attitude, healthy diet, your being positive and stuff. But if you're talking about getting some juju juice from Africa and you're going to drink it, it's going to improve your immune system, that ain't happening.
No. I was speaking of like our foods and our different things like that.
But, and I agree with you. I mean, he kind of ran it down, getting, proper sleep, eating lots of fruits and vegetables. The vitamin D thing is kind of iffy because the quantity of vitamin D they say you need to take to help is probably way more than what you need for other health conditions. But that alone will not probably protect you completely against COVID.
Dr. Terry,
But-
doesn't that zinc in the elderberry do that help?
If you're asking for clinical studies that prove that, no, but I myself was taking elderberry.
Yeah.
And so I think anything that can help your immune system is good, but it's probably not going to combat COVID. The other thing I wanted to say is we're never going to get to 100% vaccinated. That's not even the, there's some people that can't get the vaccine. There's some people that'll never get it. It's just if you have an opportunity, the more people that get it, I do believe that it's going to help our situation. We're going to be dealing with this virus forever, but the more, and viruses mutate all the time. And so we're going to continue to have these variants, but the longer there are a lot of people out there that are not vaccinated, it's going to be a problem.
I think what you folks are looking for, and these are some of the words that are thrown out, the politics, Fauci, and all these guys, and I really don't even know, they do not understand their own definition, what herd immunity is. Herd immunity is what we...
They're not.
Here's an example. Does anybody know how the alpha virus really got started? You guys know that or no?
The who?
The alpha. What we going with? You know how it started? It started in Kent, UK. Person had the original Wuhan strain. The patient was chronically sick for 6 months. They gave him remdesivir, they gave him malaria medication, etc. in a body that was already dying, and the person coughed and infected people. That was the first mutation. The virus got to see it. Then when that person got coughed in Kent, well, a lot of people from Africa would go to Kent. Got on a plane, went down to Africa, home. Coughed, the virus, subclinical, sees it, mutates. Italy, same thing. It's just a mutation, the environmental express of the environment for the virus and stuff. It's going to change because it has to change. That is why if we're ever going to get control of this, we have to have 100% of everybody vaccinated or nobody vaccinated at all. We can't have a black kid in Africa not vaccinated and a kid on an Indian reservation in Colorado that's not vaccinated because they can become patient zero. All about mutation genetics.
So why aren't they releasing the patent so that they can make this for everybody?
That is the.
Why don't they release it so the whole world can have
That's the money part. That's the money part. Because they're able to, the technology, they're able to, they could.
They could, right?
They could. That's where I think it does come down to the money part. We do know that people are making some money off the vaccine. That doesn't make it a bad vaccine, but that's capitalism in my mind.
But if you tell me it's not a bad vaccine, this is how I'm thinking, and it's confusing me. Don't tell me I got to go get a vaccine, and I got to get a booster, and I got to get another one. When my sister or brother from India come over and kick it with me, but you won't give them the vaccine. Right. Like, it doesn't make sense.
You don't have enough money.
But the point that I'm making, if this is as dangerous as they say it is, and the whole world is infected with it, and I know America has put billions of dollars giving the pharmaceutical companies the money to produce it, you release it for free because it's a pandemic for the world. If you're serious about removing it, but if you're not, what you do is you keep making money and you don't care about the world, including Americans. It's not logical.
Well, I'll tell you what, we're going to think about 3 more questions from you guys, and I appreciate that, and I do believe that it's all economically based. That this is a capitalist nation, it operates on capital. If you don't have the money, stop talking to me. This kind of thing. That's essentially why they continue to do it. Right. So let's take about 3 more questions from you guys, at which time we'll then come back and have your closing remarks from you guys. Okay. Yes, sir.
So for those of us who've either been forced to take the vaccine or have the vaccine or whatever, it just seems like some of the community looks at us as, like guinea pigs. Like, wait and see, like and I'm fine with that. Like, if it makes my community feel better to wait and see what happens to me before they decide to get the vaccine, that's fine, right? But when we talk about boosters and we talk about all these other things, like what are some of the side effects that those of us that have the vaccine, what should we look forward to, or what can happen? What is that? Right, exactly. Right.
I understand what you're saying, but this is the question. Who won the race between the turtle and the rabbit? The turtle always wins because he's rock steady, patient and stuff. Sometimes you rush too fast, you're gonna make a mistake. And great. I'm glad I'm pro-vaccine. I love vaccine. I inject children all day with vaccine, but the vaccine I'm gonna inject them, I know it's been proven in science and medicine because I don't want to have what's called blowback. I don't want no kid playing basketball with myocarditis of the heart and fall out on a basketball court. Guillain-Barré syndrome, Bell's palsy, platelets in the leg. I can go on, clot. We can go on and on and on. And people that are immunocompromised organ transplant patients have already proven it. You get the vaccine, you ain't making any antibodies. So they tell them to mask up. So you got to get back to your basic ground game. So I completely understand that.
Okay. Yes, ma'am.
Since you're the vaccine expert,
Who?
you.
Yeah, that's a viral.
Why are there so many different strains of the vaccine, and what's the difference, and what would you recommend?
Now, there's no different strains on the vaccine. There's different companies there's like 98 different types of companies.
Okay, what's the reason for that?
Right, well, because everybody's in the business of making money. The best vaccine out here, take this to the bank. For this D614G, the alpha strain is called COVAX. COVAXX. Let me repeat it again. COVAXX. That vaccine makes 32,000 neutralizing antibodies. Synthetic polypeptides, game-changing, huge. The rest of these companies, Pfizer, J&J, Moderna, combined make 1,000. That's pretty low. So what I'm saying is that everybody's doing different things, different technology, messenger RNA versus kill and attenuate. We can go on and on and on. At the end of the day, it doesn't matter. You're injecting the virus in somebody to produce antibodies. We're creating an infection in you, a controlled infection. That's what vaccines do. I weaken the virus, I inject you, your body looks at it, 14 days, you start making antibodies, and then you hope that you make what we call long-term antibodies, or amnestic cells, B cells and T cells, so when you get infected again, you make another antibodies to fight that. But this is the question you answer, is the question that you want to know, then why do people got to get a booster? Mm-hmm. Period. And it tells you that the reason why you got to get a booster is that, why? Common sense, why you got to get a booster?
Because it's not effective. It's not effective. It doesn't.
Why do you have to get a booster, folks?
85 days.
Mm-hmm. Yeah, 85 days. So why you got to get a booster? So that's what it's. In this booster shot, y'all gonna be paying for it. Y'all gonna be paying big dollar for it. Let me tell you that right now. Ain't gonna be no freebie from the government.
Yeah, so let's take a couple more. If you guys have a couple more questions before we move into closing statements. Yes, ma'am. Yes.
Now, does this virus only affect people with underlying health conditions? because me and my whole family were infected with COVID in April, and my 11-year-old brought it home from school. She went to get tested at the ER. She was negative, even though she lost her taste and smell. She ended up passing it to me. I didn't get any kind of X-ray, anything. They tested me for COVID. Oh, quarantine for 7 days. It'll still be in your system, but you won't be contagious. I didn't get overly sick. I stayed in bed 3-4 days, and then I was fine.
So this virus, unfortunately, can affect everybody, and younger people with the Delta are being more affected than they were when we had the original version. But you don't have to have chronic diseases. People that are at higher risk have chronic diseases. People that are immunocompromised, they've had a transplant, or they have some immunocompromising disease where they're on medications. But anybody can be affected and infected. And how it manifests can be different. You can have no symptoms. That's why they tell people to wear a mask. You could be infected and not have any symptoms. You could have a whole host of symptoms. I know for the original COVID, one of the hallmark symptoms that people have was a loss of taste and smell. That's something that's very specific. Because you can get a cold or cough, a headache from just a regular cold. But with COVID, when people said they lost their taste and smell, you knew. And I came across several patients who their testing was always negative, but they lost their sense of taste and smell. They had all the other symptoms. So we said, you've had COVID. So anyone can really get it. And even if you've gotten it before, we don't know how long your immunity lasts from your natural immunity. But they still are suggesting that people that have had it before get the vaccine. And we know the antibody production, when you get the vaccine and you've already had it, is going to be much greater than other people that never had COVID.
And I would say, I think one of the take home, adding to what she's saying, on the Delta strain, the Delta strain is truly an equal opportunity employer. It's hitting everybody. I've gotten called in the last 2 weeks from people from Mexico, LA, 136, 124, 24 years, spitting up blood at his home and stuff. And the main symptoms, guess what they had from the Delta? Headache. Headache. Not a cough. Headache.
Yeah, they're saying with the Delta for sure, the symptoms are a little bit different, headache and runny nose, fever, as opposed to some other
Yes. And here's the deal, guys. This was just general information for you. With the coronavirus infection, guess how many symptoms you can possibly have? There are over 200 different clinical symptoms you can have. So that's a lot of symptoms from A to Z. So,
Okay, all right. So, yes, ma'am, one more question and then we'll start wrapping up.
I just wanted to follow up on the COVAX vaccine. And that vaccination, I believe, is not available to us.
well, so it's, okay, I'm sorry. Let me finish your question. I'll come back to that.
Yeah, so I just wanted to know, out of the vaccines that are available to us, which one would be recommended? I don't know who can answer that question.
Well,
but
on my
it's
thing, that's
for all
what people try to
doctors.
pin me down on vaccine. I don't know why everybody want to pin down Dr. Chocolate Latte. I ain't let nobody pin me down. But anyway, I always tell people, you make the best decision for yourself. Let's put it this way. If you end up with a complication from that vaccine, who won't pay for it?
We have to.
Your child goes blind. Let me finish, Jason. I got called a month ago by one of my special forces guys in North Carolina, field artillery guy. If you see me, brother, I'm talking about you right now. Lady next door had a daughter, handicapped. She was a savant, artistic, 26 years old. Got the Pfizer shot. 3 days later, she went from 26 to a 3-year-old. Had to put her in an institution. This is real life, on the ground situation. I already know what happened because I can see the virus inside the cell doing what it needs to do. And that's why when we start talking about nutrition and all this stuff, it's great. But you guys have to understand that once that virus attaches to your cell, that virus goes intracellular. It's inside your cell. So you got to realize the effectiveness of the virus itself, but that's my thing on that.
So I would add, because I do like to be put on the spot as far as what I would recommend. And I do like the mRNA vaccines. That's the Pfizer, the Moderna. I favor the Moderna. That's what I got. And when I reviewed it recently, it's the one that's more effective against the Delta. That's what I've read really recently. So Johnson & Johnson, I know it's associated with the baby powder and all that, but I've seen too many unusual complications with the Johnson & Johnson, so I would go with the Moderna. The Pfizer's okay. Kids, if that's the only one kids can get right now is the Pfizer.
And that's what I heard was because, the thing that they were putting out with Moderna was it was created by a black woman, right?
Yeah, kids meet, yeah.
And that's where we feel more comfortable because it was made by a black woman.
Yeah.
I want to put myself on the spot too. I like to strongly recommend to patients either Pfizer or Moderna. I happen to like Pfizer a little bit more. But I tell you what, before you get it, I usually recommend you take a Tylenol.
Not before.
Yeah, and then listen to me. I'm the guy who has I'm in the trenches, okay?
I'm in the trenches.
We're gonna get rid of some of these side effects that it potentially take Tylenol and have Benadryl, and it help take care of some of these symptoms you do.
Thank you very much, everybody. Now, we're gonna have some closing statements, but, I teach at the university, and students are back next week, and I feel like I need a mask and, some hand sanitizer, might need a German Shepherd to bite me. So, but at any rate, I want to thank you guys for this very serious conversation. I've gotten a lot of information. I'm not sure where I'm landing necessarily. I'm not sure whether you guys have been convinced as to whether you need to take it, but I do know that we need to do everything we can to keep ourselves safe. And however that may land, we need to do that. So we'll go ahead to closing statements. Dr. Richardson, Dr. Richardson.
Okay, so just as a closing, I would say that it's important to keep yourself as healthy as possible. We talked about boosting your immune system with healthiness. We talked about wearing the mask, washing your hands. I do think that vaccine is in that equation when we talk about being healthy and trying to get back to doing the things that we like to do. I miss some of the sports. I miss some of the get-togethers. I miss my Scrabble parties that I was having, where we played Scrabble and had food and all that. But hopefully you all have gotten a lot of your questions answered. We're not here, at least I'm not here to force you to get a vaccine. But I'd be lying if I said that I don't care. I do care. I care that people have the right information to make the right decision for yourself. I do think getting the vaccine is the right decision. Do I know what's going to happen 5 years from now? I understand people's fear. We don't know what's going to happen a year from now, 2 years, 5 years from now. But I've seen people crying when their people have died.
Of course.
And that didn't have to happen. So I would encourage you, think about it. Read credible sites like CDC, Mayo Clinic. Read the National Medical Association, what they're putting out there. And make a decision. If you don't want to be vaccinated, don't go to Walmart, especially without a mask. I don't go to Walmart anymore. They have too many positive cases among their employees. So it doesn't matter what decision you make, get it, don't get it, but don't just run around without a mask like I see people doing. Close proximity, and you're not wearing a mask and you're not vaccinated. To me, that's like suicide. And I'll stop at that.
Thank you, Dr. Richardson.
Yeah, guys, I'm a clinician. I'm pro-vaccine, but I want to let you guys know it's a pleasure to have you guys even have this type of exchange. And don't feel as if you've done something wrong because you have not gotten vaccinated. I think a part of it is education and building trust with the community. I'm telling you, as a clinician, I'm embarrassed to say we blew it. This virus just kicked our ass. We could have done a much better job at the point of service, so we wouldn't be having this conversation today. And it started from the top, and like you said, the healthcare system got crushed. It was almost literally bankrupt. And the system said, this is going to bankrupt this whole country. So it wasn't quality of care we were worried about, it's cost of care. Because I'm telling you, we were going down the tube fast. And it started out, but the fact is that sure, if it just affected people of color, we wouldn't have to be dealing with this. But like you said, this virus Delta is so virulent. When it gets into the tissue, it just proliferates and grows. It just needs a host. So the thing about it is like next steps. What are we going to do as a community? And we have to do this together. Because we as a healthcare community is still struggling. You know, when it first came out, people got sick. We put you on a ventilator. And 80% of people died. Oh, God, we messed that up. The next thing you know, it was causing a problem with throats, and then clotting, and then vascular problems. And we've been going like, whoa. We didn't have time to recuperate. We were just doing collateral damage, trying to do what we could do. And then the best thing is like, if you got it, don't come in the hospital. We'll put you on a ventilator and surely you'll die. But we got to the point where now we at a point of not impasse, we're almost at the same place we were last year, and maybe even worse. So we got to do something that's going to be a little bit more aggressive than what we did last year. We got to get this under control, because now we're talking about kids now. So we're just going to have to do it as a community, and we're here as a resource. Now he's gonna, Dr. Chocolate gonna fly out. and we still gonna be here to help you out.
We're gonna have to have the key to the city for him to come. Hey, coming back out there. Run out there.
Well, I'll end it like this. When I came back to the States about a year and a half ago, working in the jungles of the Amazon for almost 20 years, you know, living there, taking care of people, doing real world missions, getting on the boat, going out in the Amazon, jumping out into the water, leeches and snakes and monkeys, and you hike 9 hours into a jungle, you get to a village and you take care of 1,000 children. You vaccinate them, you treat them for every disease from malaria, dengue, chikungunya, I can go on. I mean, this is real Indiana Jones type of stuff. When I came back to the States a year and a half ago, G. Carmen Michael called me, the state representative of the Black Caucus, said, Dr. Rowland, I saw that interview with you and your daughter. And my daughter did an interview, and it went 360,000 people in 7 days. She's a little bit of a famous person. And he said, we want to put you on the COVID healthcare task for the Black Caucus. I said, why me? I'm a nobody. And I've been in the jungles for 15 years. Why are you going to come and get me? Well, Doc, we research you. We vetted you. We know your military experience, et cetera, all the stuff you've done, the surgeries. You're the perfect person for us to come back to talk to minorities, because you have an international experience dealing with real diseases and stuff. And that's what I've tried to do for the last year and a half, is to educate you folks on what's going to happen. I already know what's going to happen. I told you what was going to happen last year. You're back here, and I'm going to tell you where we're going to be at next year. We're going to be having the same conversation at this moment, at this time, because of the different viruses and different mutations and stuff. So my responsibility to you is to give you guys factual, effective information based off of science and medicine, and not because I got to feel good. Because the feel good puts you in a body bag. And so that is the reality. So I hope that you guys learned something today. You can get on and you can Google me. I got everything from all the videos and the lectures and stuff. And if you really want to get truly, you can more than likely, I would love for you guys to take my class. I have a class every Thursday. I teach basic virology, epidemiology. Would you get on the internet? We can talk about it live and all that stuff and learn more about this, because you guys are all going to become microbiologists if you're not now. Period. You become virologists. Period. You're going to have to. And folks, take this stuff seriously. This is not a game. And like when I was in Arkansas 2 weeks ago, and the baby started dying, kids that are on lung heart transplants machines are dying at 12 and 13 in Arkansas because they got a governor that made a mandate you couldn't wear a mask. Now he's trying to backtrack, talking about y'all need to wear a mask. You idiot. You killed everybody in Florida, Texas. So guys, take this stuff serious and become your own bubble, become your own ambassador for your health. Dr. Johnson, Doc, they're great people. We're not monolithic. Everybody got different opinions and stuff, and that's just reality. You get the best information based off of science and medicine and people that are really doing this stuff in real time. When you do that and you follow me, you're going to make it. I tell everybody I have a thing, go social media, I'm gonna make it to the other side, or you come along with me. And that's, I hope you guys do that.
Well, we want to thank the Hodges for hosting us today. Keisha. Boss lady, Miss B. Harris, and our one of our lead staffers here, Miss Tanya Ishikawa, also with CoLab, and thank you very much, everybody.
And Mr.
I'm sorry, I wanted, before everybody disperse, I do want to introduce my wife.
We gonna introduce you.
Oh, well. I want to show what kind of jungles I'm from.
All right. B, I know you can give us a fund, but I might not have this opportunity again. When we do have another forum, another item I'd like to put in is why we've allowed 1 million people to come across our border with no kind of tracking of their immune systems. And no, the point that I'm making is maybe the next time we have one of these kind of forums, you guys can help us connect the dots, because the distrust isn't because you guys don't tell us about the vaccine. The distrust is because nothing makes sense with keeping the vaccine alive and well. So that's the issue for me.
Well, a simple question is that do viruses have a conscience?
No, simple question is why you let 1 million people into this country and you don't take care of the people you have.
She said what you meant.
That's what you said.
Dr. Richardson was that
Oh, you want to get restarted.
Okay.
You know what? I want to introduce Andrea Mosby. I've been knowing her for many years, and she will be running for
District 4 School Board.
School Board.
So if you have a chance,
I hope everyone has enjoyed this. I know we still probably just, hope you found some kind of answers. There's probably still a lot more that we need to, need to get answered. But with the limited time, we only can do so much. But before, we got these wonderful gifts that we want to give to our speakers today. And these are, if you open them up, if you like to look at them, these are special gifts. Be real careful, little Dr. Rowland. These are stained glass. Be real careful. These are from my stained glass artist. Who's and these because I'm gonna take it because we don't want to. I don't want to. This is from her Love series. Wow.
Oh, that's
all
beautiful.
of them are individually made, and they're love. Yours are different, okay? But these are from her Love series because you guys love the community, okay?
Yeah, you guys are. Thank
you. And so, Miss Keisha Hodge.
Yes,
would you
Ms.
come up
Harris.
here and tell us, you got a special donation, we got a little donation for you, and thank you for supporting us for Struggle with Love, but tell all these people about your wonderful husband.
Actually, as spokesperson, I will say it was a pleasure hosting today. I'm still confused after all that. So I think I'll do a little more research of my own because I think that's the best way to educate yourself is to actually.
And we're gonna write an article, to the urban spectrum about this. We're gonna summarize this and give it to you guys.
Good.
Okay.
Thank you.
And I know it's on Facebook Live, and we can go back and watch the video if we have questions that you might have already answered. I can refer to that as well. But I think I needed to do a little more research before I'm all the way ready. I'm not vaccinated either, and it's just because of all of the confusion and the different things that and the different vaccinations that are available. It's like we don't know, and that's why I said in the beginning, you don't know what you don't know, and I was hoping that this would provide a little more knowledge for the things that I didn't know, and I have to say I did walk away knowing a little bit more, so I appreciate you all for sharing and being here. Thank you so much.
And then tell us about
this is the founder of the Struggle of Love Foundation. My husband
a little past of what we do. For those that may just be learning about us, my wife and I, we've been running this thing for about 16 years. all over the city of Denver. We started on the west side, and then we found a home out here where we bought homes and stuff in Montbello, so we just kind of stayed over here in Montbello, Green Valley Ranch area, trying to
Where I grew up,
where
I'm from.
where all of y'all from? All of y'all from here,
Amen.
right? I just been been blessed to be a guest of this opportunity because I'm from Chicago, and when I got out of doing my kind of weird life stuff and choices.
When he stopped being a virus.
They found a vaccine for you.
And that vaccine is love, right?
That's
so,
right.
So we, we built this little thing from ground up, starting with just community outreach or events, and then we started doing, our Thanksgiving and Christmas things that we'll be going into our 14th and 15th year doing. We've been blessed to finally retain a staff of. We have about 11 on our staff now from a year ago. It's just volunteers out during COVID, handing out food and stuff and keeping the community alive. I just want to thank y'all for coming out. You can look us up on our website and see what we've done throughout the years. And we kind of like pleasure like this, man. We're not in the jungles, but we're in the projects, I guess you could say. So we try to stop those kind of viruses that's collapsing our neighborhood as well. As our family structure, our mental health, our trauma issues that we face on a daily basis in our community. So we have secondary prevention, which Jason Mcbride heads, a Sacks of Love program, which my youngest son, Dean heads, and a lot of youth he hires to keep them off the street. And we had 25 youth over the summer working through our summer youth program with the city and county of Denver. So it's been a pleasure to grow. It's a pleasure to meet beautiful, black, intelligent men and women, doctors. I would love for you guys to expand this to our youth, so our youth could see that we still do have beautiful black leaders that are not just street. If that makes any sense. So I would hope y'all could turn that mission into that fight with us, because you're fighting with the medical, but we don't know, right? So I didn't know it was a Black Doctors Network all this time till today. So now that I know that, I can spread that to the community. See what I'm saying? So that work, trickle it down to us, so we can get it out to the community, because we're in the community. And what you doing, young man, with the jungles and doing scorpions and but our youth, and I'm glad one of my sons got to meet you and see that and hear that, because it might inspire him to learn about medicine and that kind of chemicals type of stuff. You know what I'm saying? So it's been a pleasure. Thank y'all for coming out.
Can I say lastly, thanks to be here?
Yes.
I was just going to say, before we close it out, does anybody have any burning question you'd like to ask?
Yeah, I just like to say one thing. I'm Thomas Russell. I am the Cyber Education Program Manager for the National Cybersecurity Center. We have education opportunities for people of color. It's going to be free. If you say you're going to go through BEAG, get in touch with me, and it'll be free for anyone that you have. It could be a son or a daughter or a friend. If they want a free education that leads to certification, our training leads to certification, get in touch with B and she'll get in touch with me. And I'll make sure that I'll take off the charge that we would normally do. And you have first class instructors and everything. So just give her a call and let me know, okay?
So he came today.
So, and there still is the vaccination clinic downstairs from 9 until 4 o'clock. I know most people probably were not convinced to change any decisions today, but they are here with all 3 different vaccines. So now that you've heard opinions on what vaccines are the good ones, so, and if you had friends who wanted to get vaccines, I bet then they could get here within the next hour, they could tell them.
2 to 4 today.
Yeah.
Make it happen, guys. Scared, go to church.
So thank you all for coming. DenverUrbanSpectrum.com.
Just
You
don't
can't
know
find
which
the,
That's right.